Will anthrax be the next pandemic? What do you know about this disease? What is anthrax? Is anthrax contagious?
Anthrax is a life-threatening infectious disease caused by Bacillus anthracis that normally affects animals, especially ruminants, such as goats, cattle, sheep, and horses. Anthrax can be transmitted to humans by contact with infected animals or their products. In recent years, anthrax has received a great deal of attention as it has become clear that the infection can also be spread by a bioterrorist attack or by biological warfare. Anthrax does not spread from person to person and is not considered contagious. There have been a number of outbreaks over the years that are usually localized. Most recently in 2016, in Siberia, Russia, there was a major outbreak of anthrax that sickened at least 13 Siberian people and killed over 2,000 reindeer. Authorities believe that the melting permafrost unburied a reindeer that died of anthrax 75 years ago, causing the release of anthrax spores.
What causes anthrax?
The agent of anthrax is a bacterium called Bacillus anthracis. While other investigators discovered the anthrax bacillus, it was a German physician and scientist, Dr. Robert Koch, who proved that the anthrax bacterium was the cause of a disease that affected farm animals in his community. Under the microscope, the bacteria look like large rods. However, in the soil where they live, anthrax organisms exist in a dormant form called spores. These spores are very hardy and difficult to destroy. The spores have been known to survive in the soil for as long as 48 years. The bacteria secrete toxins composed of 3 proteins termed protective antigen, lethal factor, and edema factor.
How is anthrax contracted?
Anthrax can infect humans in 3 ways. The most common is infection through the skin, which causes an ugly, dark sore. Humans and animals can ingest anthrax from carcasses of dead animals that have been contaminated with anthrax. Ingestion of anthrax can cause serious, sometimes fatal disease. The most deadly form is inhalation anthrax. If the spores of anthrax are inhaled, they migrate to lymph glands in the chest, where they proliferate, spread, and produce toxins that often cause death.
How long is the incubation period with anthrax?
The incubation period, the period between contact with anthrax and the start of symptoms, may be relatively short, from 1 to 5 days. Like other infectious diseases, the incubation period for anthrax is quite variable, and it may be weeks before an infected individual feels sick.
What kinds of diseases does anthrax cause, and what are the signs and symptoms of anthrax infections?
There are 4 forms of disease caused by anthrax: cutaneous, skin anthrax, inhalation anthrax, gastrointestinal, bowel anthrax, and the newly designated injection anthrax.
Cutaneous anthrax.
The cutaneous, skin form of anthrax, 80% of all anthrax infections, starts as a red-brown raised spot that enlarges with considerable redness around it, blistering, and hardening. The center of the spot then shows an ulcer crater with blood-tinged drainage and the formation of a black crust called an eschar. There are swollen glands, lymph nodes, in the area. Symptoms include muscle aches and pain, headache, fever, nausea, and vomiting. The illness usually resolves in about 6 weeks, but deaths may occur if patients do not receive appropriate antibiotics.
Injection anthrax.
This new form of anthrax has been identified in heroin-injecting drug users in Northern Europe and has not yet been reported in the United States. Symptoms may take days to months before they appear. The signs and symptoms of injection anthrax can include small blisters or bumps that may itch at the injection site, fever and chills, swelling around the sores, and deep abscesses may develop under the skin or muscle. Painless skin sores with black centers, dark scabs, may appear after the blisters or bumps develop.
Inhalation anthrax.
The first symptoms are subtle, gradual and flu-like influenza, with a sore throat and headaches. In a few days, however, the illness worsens and there may be severe respiratory distress with shortness of breath and pain in the chest and/or muscles. Some patients may begin coughing up blood. Shock, coma, and death follow. Inhalation anthrax does not cause a true pneumonia. In fact, the spores get picked in the lungs up by scavenger cells, called macrophages. Most of the spores are killed. Unfortunately, some survive and are transported to glands in the chest, called lymph nodes. Lymph nodes may swell. In the lymph nodes, the spores that survive multiply, produce deadly toxins, and spread throughout the body. Severe hemorrhage and tissue death, necrosis, occurs in these lymph nodes in the chest. From there, the disease spreads to the adjacent lungs and the rest of the body. Inhalation anthrax is a very serious disease, and unfortunately, most affected individuals will die even if they get appropriate antibiotics. Why is this so? The antibiotics are effective in killing the bacteria, but they do not destroy the deadly toxins that have already been released by the anthrax bacteria.
Gastrointestinal anthrax.
Now rare, anthrax of the bowels, gastrointestinal anthrax, is the result of eating undercooked contaminated meat. The symptoms of this form of anthrax include nausea, loss of appetite, bloody diarrhea and fever, followed by abdominal pain. The bacteria invade through the bowel wall. Then the infection spreads throughout the body, through the bloodstream, septicemia, with deadly toxicity.
What is the treatment for anthrax?
In most cases, early treatment can cure anthrax. The cutaneous, skin, form of anthrax can be treated with common antibiotics such as penicillin, tetracycline, erythromycin, elotocin, Uriped, Uritab, and ciprofloxacin, Cipro. The pulmonary form of anthrax is a medical emergency. Early and continuous intravenous therapy with antibiotics may be life-saving. In a bioterrorism attack, individuals exposed to anthrax will be given antibiotics before they become sick. A vaccine exists but is not yet available to the general public. Most experts think that the vaccine will also be given to exposed individuals who are victims of a bioterrorist attack. Of note, anthrax is a reportable disease. That means that local or state health agencies must be notified if a case of anthrax is diagnosed. These agencies can better characterize the anthrax so that the affected individual can receive the most effective treatment for that particular organism. Individuals exposed to aerosolized spores, bioterrorism scares or attacks, for example, can participate in post-exposure prevention of anthrax. 4 antibiotics are recommended by the FDA. Doxycycline, Dorix, Aracia, Monodox, ciprofloxacin, levofloxacin, Levaquin, Quixin, Iquix, and parenteral procaine penicillin G. In addition to these antibiotics, a 3-dose series of anthrax vaccine should be started as soon as possible after exposure.